Our lovely patient, who's 43 years old, is about 2 years out from her breast augmentation, which were in front of the muscle and with saline. And she comes in today and she's very graciously agreed to share some of her thoughts and feelings about how she feels about her results.
Hi, this is Elaine Adamic, and I have been very pleased with the results that Dr. Clater had provided me in my breast augmentation. I have specifically wanted something very natural to my body, and I'm a very active, and I'm a runner myself, and he did all that, and I'm very, very happy. I feel very great in my own body and confident, and I would want to recommend, if any of my friends are interested, highly recommend Dr. Clater, and I would love to come back in the future if it ever need to be adjusted.
Yeah. We talked about that, and you were asking, do your implants need to be changed at 10 years? And what I say to patients is, if there is a malposition, the implant's moving, shifting, changing, or if there's a deflation, that would be certainly a reason to do something. But if you're doing great with them, there's no necessity to change them at 10 years. Share with everyone how this change has impacted you in terms of your ability to find clothes that help you and make you feel great.
Sure. Before I had my augmentation, I breastfed two of my babies, and I was very flat, like a small A. And then I think we brought it up to almost a full C's, and I feel very comfortable in my clothes. I feel, of course, more sexier, but I feel very confident in my own skin and just, very confident naked. Versus before, I would feel very like I was missing something as a mom, as a wife, and as an individual. Yeah. And I feel really good about my active lifestyle. Yeah. I do running a lot. I run marathons, and I do a lot of strength training. And with the new breast augmentation, I don't think any of that has stopped me. And if not, I feel great in it, in my own skin.
Yeah, and I remember when we did your surgery that was a big thing, that we kind of had to fit this in between your marathon activities.
Yes, I mean, it hasn't really bothered me. It doesn't bounce too hard or bother me in any other way. I feel really good in it. I can't recommend. I guess I'm very, very happy with my investment on this part of my life.
I love it. How quickly after we did your surgery did you go back and run in your next marathon?
So we did it in 23, and I did run a marathon that year. So I would say about 6 months later. Yep. I would say 2 months later, I was able to run a 10-mile race. Wow. So it wasn't. I didn't take too many time off, but the initial first 2 weeks was, sore and adjusted. But once I got over that hump, it has been fine. Fabulous. Like living a normal lifestyle.
Yeah. And,
with bigger.
Yeah.
Breasts.
Yeah. Talk to people who are tuning in and listening, how this has impacted your own self-confidence.
I do feel confident as a woman and as a business owner, but I think with my larger breasts, it makes me feel more fuller in my clothes, and I feel that if I can wear something that has a little more open-chested, then I'm very comfortable in it, instead of having to wear an extra bra that gives me that lift. So I can just wear like nipple covers, and then it will still look very good in my outfit and very presentable, but not too showy, but still very classy.
I like that. That's beautifully said. I really like that. And that really reflects a lot of what patients are looking for when they come in. The last question I always like to ask people is this something that you would recommend to a friend?
If they are feeling that they're missing something like this in their life, and if they're ready for it, I absolutely would recommend them. Like I said, it was the best investment I had, and my husband and I, we both are very happy with it. More so myself, it just makes me feel very complete. Not that I wasn't complete before, but because I've always wanted bigger boobs, and after 2 children and breastfeeding, they deflated a lot, and so with this new confidence, I feel great.
That's awesome. Well, thank you for sharing your story.
No problem. Thank you.